If I could put myself back in the shoes when I was a third, fourth year med student, I'd want to know that there's a place where I could maximize those 3 years, go in feeling a little bit nervous, but good nervous energy, and be put in a place where on day one, it's expected to kind of play ball and deliver, be ready to learn, be ready to have a good attitude.
From day one, you're seeing just as many patients as some of your seniors. You're taking care of some of the sickest people in the hospital. They don't really shy away from that, like even if you're a first-year resident. I also love being able to work with underserved patients. A lot of the times they're at very far ends of their disease processes, so that allows for awesome clinical experience.
So UF-JACS is a level 1 trauma center, meaning that the patients that come in after a trauma are probably sicker than patients that you would see at a level 2 or level 3 trauma center. And that's because we have trauma surgery, we have neurosurgery, we have the specialties that are equipped to take care of those patients. So you're seeing some of the higher acuity patients at UF-JACS, and that's one of the reasons I actually chose this place, because I knew it would prepare me a lot for life after residency.
Well, my favorite part about the faculty at JACS is probably how approachable they are and how much they love teaching. I think every shift they make it a priority to make some kind of profound teaching statement. We start every shift with a teaching point from a fellow resident.
They're all thought leaders in their field, and so it's a great environment to be cultivated in. You might be on UpToDate reading an article and you come across one of your attendings' names. You might learn about something like, oh yeah, I worked to design that or something like that. Not out of ego, but out of, hey, it's really cool to learn from those people. So the attendings are a huge plus.
So I remember, I think in our first month of residency, we all start with an orientation block, and a lot of that is working in the SIM center, practicing all different procedures. They got us as interns practicing intubating on the SIM mannequins really early. My first EM shift in the critical care area, I think I had 2 or 3 intubations, and it's my first month of residency. Whereas some of my friends from medical school, they were at programs where they don't get to intubate for the first 6 months. So not only do they throw us in, but they make sure we're prepared.
One of the things that I was looking for when choosing a residency was basically people that looked like me. So I was looking for women, and especially women of color, and a place where I knew that I'd feel comfortable. One of the things that I remember from my interview was with Dr. Parsons. I was talking to her, and she advocated heavily for women, and women of color especially. And that stood out to me a lot, and that was one of the biggest reasons I made the decision to come here. And I have not regretted that decision ever since, because there's a heavy presence of women in the emergency department, and there are women that look like me in the emergency department as well, and we're treated exactly the same. That's something that I appreciate.
The perfect first year resident is someone that wants to kind of take action early, be ready to learn early, and be ready to teach early, be ready to go with the flow, work with a bunch of different personalities. Work hard, be nice. You're going to do well in any environment, but work hard, be nice, be ready to be put on the spot early.
My favorite thing about this residency program is the level of acuity of my patients. I get the most amazing experience. I think it's unparalleled across this country.